My name is Ann Mackin, and this is my Case Connection 2 assignment for biochemistry. Case 2. I'll help you understand the issue a little bit better. You have a condition often referred to as Mcardle's disease. This is a rare disorder where your body has a problem with the enzyme called glycogen phosphorylase. The body usually stores glucose or sugar for energy in your muscle cells, called glycogen, and it uses it when your body needs energy. Your deficiency of the enzyme glycogen phosphorylase makes it so that your body cannot use that stored glycogen in the muscle cells. This can cause your muscles to become very weak, and you will most likely lose muscle mass pretty significantly over time. I'm not sure that long walks with your friends will last for much longer. Many patients with this condition often lose the ability to walk totally. This is because the loss of muscle mass will cause extreme weakness, and also you may have a lot lower energy than the average person. I think that long walks with your friends may not be the best idea because if you walk and become too weak, one thing that we worry about is that you can fall and seriously injure yourself. You also may lose the ability to walk totally, like I said before, so walking on long walks with your friends may be out of the question eventually. This may not happen right away, but it may happen over time. You may start to notice that you're getting weaker and weaker, and then eventually you just may not be able to walk anymore. A great alternative to taking long walks with your friends, but still being able to be active, would be that your friends could walk and you could use a cane, and then eventually a walker, and then eventually you could be in a wheelchair, and it could be something that your friends could help you with, and it's a great way that you could still spend some time with your friends and be active, get some fresh air, and still have a sense of normalcy for yourself there. I don't think that you necessarily have to wake up in the middle of the night to eat for this condition. If you haven't eaten in a while, your glucose levels will drop, and the body's first response would be to use that stored glycogen because you have a problem with your glycogen retrieval system because of that glycogen phosphorylase. Your body will have trouble using this stored glycogen. It may be a good idea to eat a small snack right before bed, or, if you would like to, you could get up in the middle of the night and eat something small. Preferably, if you had a meal or a snack that was higher in carbohydrates, that would be the most ideal. Carbohydrates can include anything like bread, starchy vegetables, rice, etc. Carbohydrates increase blood glucose or blood sugar. And this would be a good idea because your body can use that glucose or sugar that you just ingested to supply energy to your body because you have trouble with that glycogen, and your body could use that during sleep. I don't necessarily think that you will really have to worry about that because this really affects your muscles, and when you're asleep, you're not really using a ton of your muscles, just mostly for breathing and if you move around a little bit. So I don't think it's really something that you have to worry about doing when you're asleep. I wouldn't worry about it, but if you are going to eat a snack, maybe try something carbohydrate dense. you do not necessarily have to worry about an excessive buildup of lactate during intensive anaerobic exercise. Remember, we talked about how you may not have the ability to take long walks anymore. Well, this also means that your body may not have the capacity to exercise compared to somebody that does not have your condition. As time goes on, your muscles are going to become very weak, so intense exercise is most likely going to be impossible for you at some point. And you may also experience a lot of lethargy and just may not have the capacity to work out like that anymore. Because you may not have the capacity to work out as much, you don't, like I said, need to really worry about the lactate buildup rather than realize you may not be able to exercise like you used to. But there are other ways to stay active. I suggest maybe a low impact exercise such as swimming. It could be really great for you. I would just highly suggest that you have someone with you to make sure that you're safe and you don't drown or anything like that. But movement in the water could be really, really good for somebody with your condition, like water aerobics or something like that, just so you can stay active. Case 3. The biochemical basis, based on the information given from the glucose loading testing of this patient, shows that the patient's blood glucose levels are extremely low compared to normal. So this means that the patient is hypoglycemic. Hypoglycemia can be caused by a lot of different disorders in children his age. Some metabolic disorders can cause hypoglycemia, such as glycogen storage disorders, any genetic disorders of glucogenesis, and other oxidation deficiency disorders. The tiredness and drowsiness are kind of symptoms that go along with some of these disorders, so that lines up. However, the hypoglycemia in conjunction with excessive thirst and frequent urination are all really common symptoms of type 1 diabetes. I believe that if we tested the patient's fasted blood glucose levels, they would be higher than the normal range. Blood glucose under 100 milligrams per deciliter is considered normal, and 100 to 125 is considered pre-diabetic, and anything over 125 is considered diabetic. The doctor that is looking into this condition should be able to perform further testing to look at the antibodies found in patients with type 1 diabetes to distinguish the difference between type 1 and type 2 diabetes in this patient. I believe that this is type 1 rather than type 2 because the patient is only 5 years old, and usually type 1 diabetes shows up in early childhood rather than type 2 diabetes, which usually shows up in adulthood. So, and this can be caused by genetics, anything like that. The two regulatory enzymes that I believe are likely to be active in this patient's condition would be pyruvate kinase and phosphorfructokinase. I expect that these enzymes are going to be much higher in this patient compared to somebody that did not have this condition, and I believe that we can lower the enzyme levels to kind of a normal level with the use of insulin as needed for this patient. And this is going to be a condition that's treatable but not curable. So this will be a lifelong condition for this patient.